145, sir.
145. 145. Okay. 145. So no,
MBBS
you
and
all have dental students. Okay.
MBBS and
But
BDPS.
right now, I think only the dental students will be coming. All the dental students also will be coming right now. No, right? Any idea?
No, sir.
No.
Okay. Otherwise, you all are 100 and few more, I think. 100, I think. 100 and few. Yeah. Okay. So, how are your classes going on? How are your classes going on? Is it fine? Any suggestion? Any improvement? Anything that we can do? Nothing. All is good.
Yes, sir.
Okay. So basically, see, this is how things will go on for a long time now. We'll think of other modalities which might be easier or something like that. But generally, this is how it's going to go for a long time now. Okay. Mm. You all will have to be ready with this kind of way of classes and all. And probably you'll be accustomed to it also as well. Okay. Okay, see, so I don't want some kind of an dull class. I want it to be interactive and all. This is my first class with you all, right? So I don't want the class to be dull, or I don't want the classes to be silent one where I'll be speaking and you all will be silent. I don't know if you are listening or not, attending or not. I will not know. So I don't want it to be that way. So I want to interact, and to interact, I cannot jump over to this. I want to try one new platform with you. I just want to try something new with you. I'll post one link right now. I'll post one link, and while you listen, if you all are using your mobile phone, just toggle between the apps. Go to this the app that Google Chrome link that I'll be giving you, and then type in your questions over there. Okay. So that way, while I present, I can see your questions and queries as well. So that is what I want. And with any question that I ask, I want you all to answer. While answering, there is an option to remain anonymous. I don't want you all to remain anonymous. I want your name as well. So if you just check that out, your name will come. If you sign in with your Google account, with the account that we have given, your name will come automatically. Otherwise, whatever account is there, your name should come. I have opened the link for all. So I think it should not be a problem. I'll just post that link over here. Okay. Go to this link, slides.app.google/mj 4 small o 5. Type that in Google app, in any of your Google Chrome, and then I'll just see your questions over there. So that way I don't have to swap between the apps and all. I can concentrate away. While you post a question, you'll have to come over here. Occasionally I'll be putting this this link on top of the slides. It will come automatically on top of the slides. Sometimes it will come, sometimes it will not come. So if you need, just click that. I think it'll be easy. Has anybody gone to that? Anybody has tried that right now? Yes. So okay, Akash has tried. I think so. It's good. Okay. So I just want your questions over there. Okay, questions or any answers that I want. If you've got two options. I'll be talking a lot. I'll be naming you. I have your list open side by side, so I'll be naming you, and I want to know who is talking also. Don't type in anything, any questions right now. Don't you don't have to try. Okay, others don't try. Akash and Disika has already done. I think it's open for all. That means I'll be calling out your name. I want you all to answer. If you do not answer anywhere, I'll be calling your name once or twice. If you do not answer, I'll mark you absent for the class. That is a simple technique that I follow in most of my classes. So that is how I want in this class as well. Okay. So what was your last class on? Anybody? What was your last class on?
Tuberculosis.
Tuberculosis, right? So in tuberculosis, you all studied about the disease and all everything. One class or two class? I think one class, right? Yeah. So you all studied about tuberculosis and all. Basically, you are introduced a genre of topics that includes um, what do you call this? Family medicine. Okay, so in family medicine we talk about various diseases that are associated core in the family and are common in the family. That is what we want. Okay, so that is our general thing that we do when we talk about family medicine. So general disease, fever has not been taught. I think we'll decide who's going to do. We'll take that class. Fever. So another topic could be tuberculosis, very common thing. Another topic is Another topic is the class that I'm taking right now. Chicken pox, a very common disease. So these kind of things will. But what is it called? These are the diseases that are very much common in our family. Okay, that is the most important ones that we are going to talk right now. These are majority communicable diseases, and these communicable diseases you all will be studying. Most of them, most of the communicable disease you all will be studying in your fifth semester, but these communicable disease will be from this onwards. Okay, so that's the general thing. So let me start with one of the such disease called chicken pox, and any queries, anything in that question answer tool that I have given, type in over there. If you want to speak, you can just unmute and speak. If I ask a question, please do. I might even ask you all to turn on your video. I've done that, and that is one of the norms of online classes which I would like to follow in my. Let's see how the class goes, and then I want you all to be interactive. This is a very, very, very easy topic in terms of medical education. Very, very easy topic, and I love taking this class because it's very easy, and most of the students understand it very easily. And regarding your examination point of view, this is again a very, very, very common what do you call common questions. Okay, questions from this topic are very, very common. Few of the things are very, very repetitive. It comes again and again. This kind of it's such topic. Okay. All right. So let me start. Let this record session begin. Okay, if your access is blocked, then you can speak. I can't really do anything about it. I've opened the link for all, not just NNCTS ID, but for all. So I can't do anything more than that. Anyway, okay. So, chicken pox. You all can see the slides? Any problem with the slides?
Yes, sir.
Okay, very good. So, with this, okay, chicken pox. Have you heard of this disease called chicken pox? Have, have you heard of this disease called chicken pox?
Yes, sir.
Yes, right. So, what do you know about chicken pox? Anybody, what do you know about chicken pox? Nothing. Okay. How many of you all have had chicken pox in the past?
सर पानी सरा भन्ने हो र
पानी सरा होइन होइन ठेउला भन्छ यसलाई
सर यतातिर गोसाइ भन्छ
गोसाइ भन्छ ए होला I don't really know all the local terms here. Basically Nepali term is ठेउला. So I can assume safely that at least 50-60%, 70% of you all are at least having this disease. Okay. if you look at the trend, if you look at the okay, how do we know whether certain disease has occurred in a human being or not? Any idea regarding that? How do we know if certain diseases has occurred to a human being or not? What test can we do? What test can we do? Certain XY presence of antibodies. Very good, Akash. So presence of antibodies, right? So presence of antibodies is one very good indicator to say that whether that disease has occurred or not. And which antibody? There are various types of antibody. Which antibody? Anyone? IgG. Very good struggle. Uh, IgG is the one that lasts for a long time, right? So certain diseases, not all. IgM is just for recent infection, yes, but to know whether certain disease has occurred in a person or not, we usually go after IgG, and IgG is the long-lasting one, which is present for a long time. And any diseases that has got long-lasting immunity will have IgG presence in the body. But there are certain diseases which IgG, even if you get the disease after a few months, after a few years, IgG might be negative. That means that immunity against that disease has gone down, right? So that is the basic thing. So if you look at the antibody status, if you look for IgG levels, okay, I'll talk about it in a while. So okay, so chickenpox. Chickenpox basically, it's a highly contagious disease caused by varicella zoster virus. Varicella zoster virus. Humans are the only known carriers for the virus, and humans are the only known carriers, and typically an infection of the childhood. Typically, okay, you remember the term of there. Typically, infection of the childhood. So why is it called typically of the childhood? Is because normally it's the children that gets this disease, and after about few years of life, they don't really suffer. Adults, very low rate of their suffering. So okay, so basically, it's the human beings. Sorry, yeah, it's the human beings that are the only carrier, and children are the one. Most of them are in the childhood. I'll talk about it why, especially in the childhood, in a while as well. So my one basic feature of this disease is it's marked by an outbreak of fluid-filled vesicle all over the body. Now, what does this term mean? Marked by an outbreak filled with marked by an outbreak of fluid-filled vesicles in the body. Any idea? Outbreak. What do you mean by outbreak? What do you mean by outbreak? What do you mean by outbreak? Anyone, come on. What do you mean by outbreak? Any idea regarding what is outbreak? What is outbreak? No one. Okay. Eruption spread. Okay. Uh, if you can see this kind of typing, if you rather than the chat over here, if you can do it in that link that I gave you, that will be much easy for me. That is what I want. Okay. If you can, if you really cannot, then it's okay. But okay, it's just if you're using mobile phone, it's just toggling between the apps. If you're using a laptop, it's just a different tab, all tab you can use. So please, I would ask you to do that. Okay. Outbreak. Let me see the answers that you've given. Spread throughout the body, spread, uncontrolled spread, sudden appearance. Not about the body. Outbreak is basically in the community. Right now, we're having an outbreak of coronavirus, right? COVID-19, right? So that is the outbreak. So basically, outbreak is widespread, huge number of cases, surging number of cases. Uh, suddenly there is huge number of cases, and you have to deal with huge number of cases, and the cases have got typical features of what do you call fluid filled vesicles, that the fluid filled vesicles all over the body. That is, this is the this fluid filled vesicle is the clinical part. It's the clinical part, and this is having occurring in the community. So if you can see this closely, there's one small vesicle also observed. I think those will be much more clear. So basically, it's that. Okay. Now, whenever we talk about diseases over here in community medicine, we try to explain in terms of epidemiology, agent, host, environment. Three things. Okay. We talk about mostly about three things: agent, host, environment, so that it's easy for you to understand. So that is the basis of prevention. If you know about the agent, host, environment, you have to break that chain to stop the disease, right? So that is what we want. Human alpha herpes virus 3 is the herpes zoster virus. That is the herpes zoster virus. And primary infection is followed by latent infection about 10 to 30% of the people. So basically, this disease has got two type of presentation. This organism present in two type of form. Primary infection is chicken pox, and after certain years, they may occur a latent infection. And latent infection occurs in roughly around 10 to 30% of the people who've got chicken pox. They might have latent infection, 10 to 30%, and it's called herpes zoster specifically, or shingles. Herpes zoster. Okay. Herpes varicella zoster. Sorry, not herpes zoster. Sorry. Varicella zoster. It's called. So that is how the disease is seen. Two types: primary and secondary. Primary is chickenpox. Secondary is the one that you see in late life. About 10 to 30% of the people who had got primary infection, secondary infection, and it's presented in the form of varicella zoster. I'll talk about it in a while. So basically, the agent is one agent: human alpha herpes virus 3. Okay, it's also called varicella zoster virus. It's also called varicella zoster virus. So source of infection is a case of chickenpox. So that get this disease. And scabs are the non-infective part. I'll talk about scabs in a while. Infectivity about 1 to 2 days before the rash appearance to about 4 to 5 days after the rash appearance. So see, a person with chickenpox will be spreading the disease 1 day before that person gets the chickenpox. Are you getting the point? What happens is that the disease, the organism enters the body, will start to do certain change in the body. That change will cause infection, right? Now, once you present with the sign and symptoms, that is basically we call incubation period. Before that presentation of sign and symptoms, what will happen is that person will start to spread 6, 7 days 4, 5 days after the presentation of first symptom, the person will be spreading the disease to other. Once the lesions are crusted, the person is no more infected. That is the basic thing. Okay. And secondary attack rate is very, very high, highly communicable, 90%. Now, what do you understand by secondary attack rate? Anybody, please answer. Okay, sorry, my audio is not clear. Still, it's not clear. Maybe just note. I did not get that. My audio is still not clear. বুঝে না যাবে নি?
Clear.
Is it clear now?
Yes, sir.
Let me just.
Yes, sir.
Okay. Something. Otherwise, I'll use my earphones. If it's not clear, please put your questions. Okay. Okay. Where was I? Okay. Should I repeat this slide?
Yes, sir.
Yes, sir.
Okay. The slide prior to this, is it clear?
Yes, sir.
Okay.
Yes.
So, source of infection is oropharyngeal secretions and lesions, skin and mucosa. That gets the lesions in the skin and mucosa are the infective part. Scabs are not infective. Infectivity period, what happens is that the person who's got this disease will be giving the disease to others 2 days, 1 to 2 days before the person knows that the person has got the disease. Okay. First time the person there is any sign and symptoms regard to this disease, before the appearance of that disease, sign and symptom of that disease, the person will start to spread the disease. So, and after the patient knows that the sign and symptom has come, 4 5 days after that, also the person will be still giving the disease to others. Okay, and once the lesions that we see in this chicken pox, once the lesions start to form crust, is they are no more infectious. And another thing over here is highly this disease is a very highly communicable disease. What do you mean by highly communicable disease? Secondary attack rate is 90%. What do you mean by that? Any anyone? Probability that it infects others. Very good. Okay, Ekta. I think you probability more than the probability. I would use another term. Uh, one index case, first case, once the person is infected, if the person gets chance to infect other people, that means a person, let's say a child has got the disease. Okay, the child goes to a school, and everybody in the school is like, nobody has got chickenpox till now. So everybody in that classroom, especially, is has got the chance to get that disease now. The primary case, index case, will spread the disease to others. They will spread the disease to others, and another person will spread the disease to others. Let's assume a situation where one person is sick, and they go and sit in a classroom with 100 people. That person ultimately, if everybody is there in the class always, and they don't they really take a precaution to stay back home, if they stay at school, about 90% of the class will ultimately get affected. Okay, that is the general thing. And right now, you all, how much of COVID are you listening to in media? How much of COVID are you listening in reading scientific materials? Anyone? Coronavirus? अहिलेको यो
So around
SARS-CoV-2
80%.
virus. So you'll have heard of the word reproduction rate, R naught values, all that thing. Coronavirus, it's roughly around 2. Okay, roughly around 2. So that means one person has got the ability to spread the disease to 2 people. Okay, secondary attack rate is something different, where the whole class, without containment, if it's led to spread, around 90% will get. Um, that coronavirus, presently we see that in normal condition, okay, one person has got a chance to spread to 2 3 maximum. Chicken pox, it's around 5. Okay, it's that much contagious. What that is what I'm trying to compare. Okay, it's that much contagious. It can quickly give the disease to others within the period of 4 5 days. Around 4 5 people will spread. Now just imagine how quickly it will spread. That's why it will be 90% of the population that will be getting the disease. 90% of the population will get the disease. That is the reason. Okay. Now that is secondary attack rate. Regarding the host, there are certain factors regarding the host that happens. Especially children under 10-year-old are the ones that get the infection, and luckily the children are able to fight the disease very easily. They get the symptoms within a week. They are fit and fine. Okay, they don't really have any complication. Most of them. Diseases may occur in the adults who did not get the disease in the past. Okay, so anybody of you, the class right now, anyone, if you have not got chickenpox till now, probability of you getting is still there, and especially there because you all are in hospital. So chances of you all getting the disease is still there, and the chances of that disease being severe is more. Okay, so adult chickenpox are severe ones. Immunity, one attack gives lifelong immunity. IgG persistent for life. So this is one disease where you can do a test to determine that will you get chickenpox in the future or not? Very easy. Okay. Second attacks are very, 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 very rare. Pregnancy, there's something regard to pregnancy and varicella, especially chicken pox. What happens is that infection during pregnancy may lead to congenital varicella syndrome. So the infant with the mother infected during pregnancy have high chances of developing herpes zoster, and the congenital syndrome, the child may have that also. I'll talk about that later on in complication. So about 2% of the pregnancy. So we don't really want a mother to get chicken pox. Most dangerous thing in chickenpox these days. See, whenever first thing when there is a disease, first thing what we want is people not to die. Okay, number one. Number two, if the people are not dying, we want the people to get less disease. Then we want people to get more, very, very less complication. Okay, so chickenpox is something that people don't really die about it, die because of it. So adult also we are preventing because of various modalities. I'll talk about that again later. So what happens is that uh, we are worried about pregnancy. This chickenpox is not bothering us in any aspect these days, but it's pregnancy that is bothering. So some of the people who are not, some of the females who have not got the disease, if they happen to get chickenpox during the time of pregnancy, then there's about 2% chances that the outcome of the pregnancy might not be normal. That is one important or one point that we it's in. So, see, Ashish has asked this question. Why? You can see the question. Why is it more severe in adult? So, this is one question. Very important question. Uh, Basically, it's the immune response. Basically, it's the immune response, but there's no specific thing, okay, happening. But the children, it's more in the and adults are more likely to have secondary infection because of this. That's why it's more severe. That is one thing. Children have got good immunity against it. They are able to build up the immunity very quick. That is the reason. Okay. So, okay. Now, regarding environmental factors, chickenpox occurs throughout the year. We see it in season, first 6 months of the year, usually January to about July, August. So spring, late winter, spring, and midsummer it ends. This is the general trend, and it occurs throughout the year, but it might occur any time of the year. Okay, whenever we see one case of chickenpox, it's wise to expect more number of cases of chickenpox. Okay, and because of its contagiousness, it can spread so quickly among the people. This can easily. This is one point that we have to really be careful about. Overcrowding conducive to spread. So overcrowding is one thing that happens that helps spread of this disease. So what happens is that in a school, one child gets sick. Even if you ask the child not to come to the school because you know that the child has got chickenpox, it's already 1 or 2 days that the child has already come to the school, right? So you can't really stop. In a family, it's very, very contagious. You have to segregate the person really high. Nursing home, if people are living together, that's another problem. In office also, it's the same reason. So those kind of situation it may spread easily. So what happens is that if someone gets in, someone, let's say for example, someone in your class gets infected, likelihood of getting the disease among yourselves is very, very high. So everybody might get the disease now. Okay, so that is one thing. Now, regarding the transmission, how does this disease transmit? It's the droplet infection, droplet nuclei, just like SARS-CoV, COVID-19 droplet. When I speak, I spit out certain particles, right? Some particles you can see, some particles you may not see. So those are the most important ones. Any droplet infection, droplet nuclei are the important ones that is going to spread. So somebody in front of me might get that, somebody besides me might get that, and face-to-face contact is most important. So children, that's why they're living in a congested place. 4-5 people living in, staying in the class in one bench, they play together. Yes. So same like COVID, you see over respiratory tract and conjunctiva, eyes, droplets in the droplets in the face, organism in the droplets in the hands, organism in the hands, and if you touch the eye or if you ingest the nuclei, then it will enter the body. Conjunctiva, respiratory tract, and placenta for varicella syndrome. That is the thing. Incubation period, if you see over here, it's very, very lengthy. It's about 14 to 16 days. So it takes a lot of time. It takes a lot of time for this disease to appear. It's a lot of time. Okay, it takes roughly 2 weeks for the person to develop chickenpox, and after 2 weeks, let's say it's usually 14 to 16 days is the average. Whenever you see, okay, one extra thing, since you all are now going into this disease portion, one thing what you see over here, you see over here 14 to 16, right? This it looks as just 14, 15, 16, 3 days, right? This means the most common time for um, large group of people, majority of them will show the symptom in around 15, 16 days. Okay, but it might appear as early as 10 days, or it may appear even as late as 20, 21 days. Okay, I'll just project one question that I just got right now. Suppose mother gets chickenpox and recovers, and later be pregnant. So will there be a chance that the child may get disease in any time of life? Okay, I want you all to answer. Anyone? Anyone would like to answer? Suppose mother gets chickenpox and recovers and later be pregnant. Okay, so say at around in the childhood, the person got. Sardul, do you mean that the mother gets chickenpox during the time of pregnancy or later on or earlier than that? I think it means earlier, right? So the mother gets chickenpox, a lady gets chickenpox after a certain while, and recovers and then gets pregnant. So will there be the chance that a child may get disease in the past, disease in the lifetime? Anybody would like to answer this? Anybody would like to answer this? Anybody would like to answer this? I don't think so. The disease will be okay. See, if the mother gets chickenpox and recovers from chickenpox, the mother will be, the lady will be having immunity against that disease. So that lady will not get that lady will not get chickenpox later on in their life. Okay, number one. Number two, will they what? So will there be a chance that a child may get disease anytime in their life? Yes, because the child does not have the antibody against it. Okay, even if you mean during the time of pregnancy, that 2% might be affected. Others via breast milk, they might produce antibodies, but that's not going to remain long. Okay, the person has to get infection to remain free from the disease. That is one very important thing over here. Banu is saying that IgG's antibodies made in the mother will be transferred via placenta, but that will not remain for a long time. Okay, these are passive ones, so that's why it's not going to remain for a long time. Okay, so let me go back to the presentation now. So transmission is one thing. Another is portal of entry. I think I talked about incubation. I think you all understood. This is the most common time, 14 to 15, 16 days. 10 means the minimum at least it takes 10 days. Maximum it takes around 21 days. I'll again compare it with coronavirus. Incubation period mostly is 5.5 days, 5 days, 5 to 6 days. Okay, mostly people show the symptoms at around 5 days, but the symptoms may be appearing even late as 28 days. The evidence of 28 days as well. Okay, so those are very, very outlier. Those are very, very rare things. So everything has got those kind of things. So clinical features, inapparent infection about 5%. So about 5% of the people, they don't show any sign and symptoms. Okay. So some of you who say that they didn't have chicken pox right now, I think some of you are saying they didn't have chicken pox and all. Uh, some they didn't get chicken pox. They might be the ones who are having inapparent infection as well. Okay, so infection is mild to severe, and most most shows typical features. What happens in chickenpox is typical features. Typical features include two stages of the disease: pre-eruptive and eruptive stage. And eruptive stage, pre-eruptive stage, pre-eruptive stage is very short. It lasts about 1 day, 24 hours. In adults, it might last for about 2 to 3 days, but it's usually very, very short. What happens is suddenly, this is how the disease progresses. Okay, suddenly the person will start to feel very, very malaise, very weak. They might be mild to moderate fever, backache, and shivering. That can happen. So it might be anything, right now. So next day, the person will move on to eruptive stage, and here the person will have start to develop appear rashes will start to appear. Rashes are often the first sign because the earliest thing might be ignored by most of the people. Okay, although it's pre-eruptive stage is there, there could be a chances that most of the people uh, might not be presenting might not feel that symptom. So it might be the first thing. Rashes start erupting with the onset of fever, usually. Okay, and fever. How is the fever? Fever is mild to high right now. In this stage, fever will be mild to high, and fever runs high often with the new crop of rash. Now I'll talk about the rashes, and you'll understand what do you mean this new crop of rash. Okay, see, fever and rashes are very very common features. Especially in childhood diseases. There are a lot of disease which presents with fever and rash. Fever and rash. Sometimes fever occurs before rash, and then rash will occur after few days. Sometimes rash and then fever. Sometimes rash and fever together. Sometimes few days gap between the rash and fever. So lots of correlations are there. Many diseases are there. You'll be studying that more in detail in your pediatric classes later on. One first day fever, second day fever, third day fever, there are various diseases. Okay, so over here, what happens? Usually, it's known in the same time, and fever comes continuously with the new crop of rash. This is probably the only disease that has got crop of rash. We talk about it. So rash distribution is very important in chickenpox. Most of the diagnosis of chickenpox is done on the basis of the rash. Okay, it's very very typical. So what happens is that distribution is usually symmetrical, means that both half of the body will be getting similar amount of rash number. Okay, and appearance more abundant in the trunk, face, arm and legs are a bit less. Face, arm and leg are a bit less. Mucosal surface involved, buccal, pharyngeal, eyes. So it might be involved. Palms and soles are spared. Palms and sole does not occur. Density is centrifugal. That means more less towards outside. When you centrifuge, majority of the aggregate, it will all aggregate down in the center, right? So it's centrifugal. More rashes center to the body, less rashes away from the body. Just imagine that most is in the trunk, and once it moves from the arm towards the palm, it's less, so less that in the palm and sole it's absolutely less. Same thing onwards. Okay, and rashes appears in crop. What it means is that today one batch of rashes will appear. After a few days, another batches of rashes will appear. Okay, and the batches of rashes that will appear will remain in the same stage. There are various stages of rashes. The stages of rashes will remain same throughout the period. So rash will evolve. Okay, so what happened is that rash has got various types or various forms of it, and first rash will be seen in the form of papule, and then uh, uh, macule, then in that macule will convert to papule, will convert to vesicle, and then it will be converted to scab. Basically what it means is macule is almost flat, same like the body skin, flat reddish patch you will be seeing. Papule is a bit raised. Okay, just a bit raised. If you are bitten by the mosquito, or if you are bitten by some insects, you see some reddish patch, that is macule. If it is slightly raised, it is papule. Okay. Here you see vesicles also. Vesicles is you see fluid collection. You'll be seeing fluid collection. That takes time to come. Okay. And after that, that fluid will be dried out and a scab will form. Scab is if you are hurt, if you do the hurt in the body, you'll see some kind of brownish debris on the skin, right? After a few days. So that is scab. Okay. So you'll see scab over here as well. And then after that, what happens is that after a few days, that scab will fall, and then the disease will resolve. Sometimes the vesicle may be converted to pustule, especially in adults. Pustule. So that fluid, well, it's usually clear. Later on, it might convert to pus. Okay. Basically, that is due to secondary infection. So often vesicular stage is the first identification stage. Why is it the first identification stage? Is that because it's in the trunk. The child is, it takes about two days. The child may not have taken a bath. Say the child got the disease today. The child wants to run around, play and all. Mild fever ignored. Next day the rashes started to appear. Maybe the child is in full clothed. The mother did not notice or the child did not notice. And then after 2 days, when you see the body, you'll see some vesicles. Vesicles is, it'll start to get itchy now. Okay. So that's why the person will start to notice it. And it's not umbilicated. Okay. There's no pinpoint in between. It's like if you have got pimples and all, there's a pinpoint. Over here, there's no pinpoint. And scabbing after about 4 to 7 days, that vesicle will dry out and will all go away. So that is the general trend. That is the general trend that happens with this disease. So crop over here, what it means is that earlier I said crop. Crop, what it means is that once a batch of rashes come, all are papule. Okay. After a few hours, it will convert to papule. Next day or so, or a few days, it will convert to vesicles, and all that vesicles will be converted to scabs later on in about 4 to 7 days. By this time, another another crop of rashes will come. Another batch of rash will come, which are in macule stage. So this way, for the 4 5 days period, various batches will come. Each batch will be in the same stage of rash. Okay, the evolution of the rash will be same for each batch. And then once you look at the body, you will get to see various things. You'll get to see macule, papule, vesicles, and scab all at the same time, indicating all the scabs you see are of the same day evolution. Papules, it could be all the papules you see could be of the same time origin, same crop, and macules could be the freshest one. Okay, so after about 7 days, it stops, and then slowly all will convert to crop. All the cropping will end, and slowly all will convert to scab, and it will end. So fever will also end once new batches will stop. Okay, is that clear? That feature where all rashes all stages of rashes are seen simultaneously at one time in the same area of the body is called pleomorphism. And this is very, 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 very diagnostic character of chickenpox. Okay, if you happen to see a child who says he's got fever and you look at the body, good number of rashes in the trunk, very few in the other parts of the body, no in the soles and palm, and then you see variety of rashes, that is called chickenpox, pleomorphism, and that is, we can definitely say it's chickenpox. Okay, so over here, I don't know how clear this picture is. Red spot, slightly raised, fluid, and then crusting. That is our scab is formed. So rash itself can be itchy, urticaria may be present. Scarring is very rare unless the lesion becomes secondary infected, and the crust falls off in 1 to 2 weeks time. So the child will get disease in about 6 days, 7 days. Crust will form, scabbing, and that scab will form a scarring. Scar will fall off in about a week or two. So once the first crop evolves from this, they say once the scab is formed, the infectivity period will stop. One feature is itchiness will occur especially during the vesicular phase. Itchiness will occur, and scarring, usually chickenpox do not have scarring. Otherwise, imagine the number of scars we would have in our body. But when I got chickenpox, I've got few scars over here. If you now it's a bit less visible, but up to 10 years ago, those scars were very much visible. That scar occurred because it got infected. Okay? If you touch that vesicles, if you burst the vesicle may be secondary infected, and that secondary infection may cause the scarring. That is one important thing. Okay. So over here, let's see. This you see red spot. These are macules. Okay. This you see over here. These are papules. Okay. Slightly raised. This you see over here. These are slightly more than the papule. This is a clear-cut vesicle. This is a clear-cut vesicle, and this you see over here is the scar that is formed. Okay. Notice the various stages of rash occurring simultaneously in the same part of the body. Just look at the hand, you find all the stages. So this is called pleomorphism. This is there, and the rashes, and this is primarily seen in the trunk and less in the arm, and that is called chickenpox. Okay, that is one very very important feature. And chickenpox is probably one of the easiest diseases to diagnose because of this character. Now, normal thing to study. Now, complications. Most are mild, self-limiting conditions. Less than 1% is complicated. Less than 1% is complicated. Okay, sorry, over here it became uncomplicated. It's complicated. Less than 1% is complicated. Severe form may present in immunocompromised and some normal adults and children as well. Okay, they include severe form complications. They include pneumonia. That is the most common one. In neonates, we might see pneumonia, varicella hemorrhagica, bleeding, encephalitis, acute cerebral ataxia, Reye's syndrome. These are the very very rare things. I think I have never seen these things. And in maternal infection, if the mother gets infected, that 2% that I talked earlier will the fetal wastage may occur. That means miscarriage may occur, abortion may occur. Sometimes the child might be born with some defect, cutaneous scars, atrophied limbs, low birth weight, cataract, microcephaly, etc. Various other things may occur to the child. So it's wise to prevent chickenpox during pregnancy, and it's very, very difficult. So who are the high risk group and who die is everyone is at risk as long as they are non-immune to the virus. So anybody can get the disease. Okay, if you are immune for life. Chickenpox is with both sexes and reported in all race. Death rate is very, 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 very less. If you talk about the death rate, it's 2 per 1 lakh people. Per 100,000 people, 2 people will die in 1 to 14-year group. That's very, very less. 2.7 in 15 to 19, a bit more. About 25 per 1 lakh. That is also very, very small number in adults. Neonatal mortality is high because of pneumonia. Okay, 30%. And likelihood of getting neonatal chickenpox is in fact very, very, very low. People with severe asthma, leukemia, lymphoma, HIV are in more high risk group, and newborns that are infected within 5 days before 2 days after 5 days, if the mother is infected 5 days before the delivery or 2 days after the delivery, chances are more, the chances of complications are more. Okay, that is one thing. Okay, now let's talk about varicella zoster. So varicella zoster, what happens is that immunity is a bit messed up over here. Basically, over the period of time, because of waning cell-mediated immunity related to immune sense, immunocompromised people or people with some kind of disease, because cell-mediated immunity level goes down, the person may present with some new feature because of the old disease, old virus that is still there in the body. Okay, so herpes zoster occurs. It is usually age-related, disease-related, and drug-related decline in cellular immunity because of that virus. So what happens is that neuronal destruction and inflammation occurs, and the principal problem is pain and interference with the activities of the daily living. So have you heard of the Nepali term called Janai Khatira? Anybody? चने खटिरा.
Yes, sir. Audible, teacher.
Yes. So, if you tell me, I think you can proceed a question. I'll just take a time and answer in a while. Okay. Uh, here what happens is that in herpes zoster, what happens is that due to some problem, if the immunity of the body is less and that virus cell mediated immunity will go down, there's some modulation in the cell mediated immunity. Basically, it responds less. So what will happen is that it will again reactivate. This time, the disease presentation will be occurring in such a way that it will damage the nerves. Okay, neuronal destruction and inflammation will cause. So once that nerve is infected, the skin area corresponding to that nerve will be affected. So varicella zoster virus becomes latent in the cranial nerves and dorsal root ganglia during the course of chickenpox. So it remains over there during the course of chickenpox. Herpes zoster caused by reactivation years after via renewed replication and spread of herpes zoster virus in sensory ganglia and apparent peripheral nerve and afferent peripheral nerve. So from there, whichever peripheral nerve is affected, it goes over there. Clinically, it is represented as vesicular rashes spread over the corresponding dermatome, supplied by the afferent nerve fiber that is there. So one portion of the dermatome is only affected. Okay, so that's why if you see the disease, it's just one portion. Basically, over here, what we try to look for is it in the different dermatome? No. Up, down? No. Is it in across the body? No. So that means it is called herpes zoster. It is a really, really, really painful condition. Even sometimes it might be like wind will, even when there is wind, you feel the wind in your body, right? When it touches the skin, you feel the wind. That might also be painful. So it's that painful. So that is one thing. Now, this is that happens very less. Okay, a diagnosis of chickenpox. Clinically, the diagnosis is clear in most cases. Clinically, okay. How clinically? Pleomorphism. This is the most important thing. Laboratory diagnosis, we might use PCR techniques to detect the herpes zoster virus DNA. Isolating the virus from the vesicular fluid cult by and doing the culture might also be the one. IgM specific antibodies or detection of IgM might also be one of the techniques, but I've never seen this being done. I don't know if it's done in here or not. We've got thousands of cases of chickenpox every year, but we don't really do it. Why? Because clinically, this is one disease, guarantee clinically you can be assured that yes, I am diagnosed correct. Now let's go to control measure. Now, if you know the disease dynamics, you should be able to know the control measure. So control measure is controlling the present disease condition. Okay. So how do you control? First is notification. There is a spread, notify. A child is having the disease, notify to the school. You don't want the whole child to get sick, whole school to get sick. Okay. Next is isolation. All cases for about 6 days after onset of rash. If you isolate, the disease will not spread. So what schools really do is, if they see one case of chickenpox, they'll ask the child to go home, stay home for 6-7 days, 1 week, come back in next week only. And other children, if they are careful, if they see the trend, they'll stop the school for 1 week. Otherwise, everybody in the school will get affected. Treatment, we use antiviral. Again, the uses of antiviral is again plus minus. Cyclovir is a very common one that is used. There are other ones also, but again, I'm saying plus minus because of the fact that it is self-limiting disease. After a few days, it will go away, and you don't really need medications. Okay. Disinfectant of articles soiled by nose and throat discharge, that is important. Good hygiene, including dating, bathing, and soaking of the body is important to wipe the virus that has been spread. Okay, basically that is the thing. If that is done, spread will be limited. So anybody living in the same household we should not be using the same towel. That is the most important one. Okay, and dresses are of course affected. Prevention. So we don't. There are immunoglobulins and vaccines for it. But immunoglobulins is we don't really use it. And to use, if we have to use it, we use it within 72 hours of exposure. What we do is we inject by VIIG. So basically, it is immunoglobulin consisting of IgG, and it's given primarily to immunosuppression people who are immunosuppressed. That means if say a child has got chicken pox in the family. The same family has got someone with what do you say, kidney transplant who is under immunosuppressive therapy. If you take the history, that kidney transplant person has not got chicken pox in their life. Now, what will happen is that chance of that person, that old man or lady might getting the disease is still there. So what we do is immediately we can give within 72 hours of exposure. If we give immunoglobulin, we might be stopping the disease. Okay, that is one. So AIDS and pregnant with newborn, if vaccine is there. OK strain live attenuated vaccine is there. 96 to 96 to 100% seroconversion. That means effectivity is so good. After about 4 weeks is there, and after 22 years, 90% have got 20 years. 90% have got good immune status. So there is one vaccine, and it's recommended for routine immunization at about first dose at about 12 to 15 months, second dose at around 4 to 6 years if they give. Um, it might work. But again, this vaccine we are not using in our national immunization system. The vaccine is there. It's wonderful vaccine. Wonderful vaccine. Okay, it's conversion 2 dose. Its conversion is wonderful. No infection. There is no chicken pox. There is no varicella zoster later on. So herpes zoster, those that also will not occur. It's a very good vaccine, but we are still not giving. Why? Any idea why? Why are we not giving it?
Less mortality.
Yes, very good. Number one, mortality is very less. Number two, complication is also very, very less. And most important thing over here, the self-limiting disease, within a week, the child will be fit and fine, right? So you don't really die. So that is why we don't really have it. This is wonderful. This vaccine is a really wonderful vaccine. Globally, they are using, but in India, Nepal, underdeveloped countries, we are not using this vaccine. Basically, because is it worth spending money? Right now, with the economy, it's not. That's what they have thought. Later on, maybe when you all are pediatricians, later on, after say about 8 years or 9 years, when you all become pediatricians, you all will be might be seeing varicella in the routine immunization, right? Like polio, like measles, malaria, measles, rubella. You might be giving varicella vaccine as a routine thing. By then, probably the vaccine cost will go down, and what do you call? Our economy will be good to afford it. Okay, so balancing the problem and the impact, I think this is a good thing. So this is it about chickenpox. I've got a few more slides, and where there I'll be talking about smallpox. I think I'll just. I think is there any queries regarding chickenpox? I got this question. I'll just project that question. Okay, Rituparna has asked one question. Won't the baby have less chance to be attacked by varicella as it already have IgG against that it got from the placenta? So I think you are trying to correlate this question with a mother having the disease during the time of pregnancy. Yes, IgG might be transferred, immunoglobulins might be transferred, but again, that immunoglobulins will be destroyed because it's passive. It will be destroyed over the period of next few days. Okay, active immunity be required. Passive immunity, others you could have all got shots of immunoglobulin just there for a few weeks, then it will be destroyed. New will not be produced. That is why even if the mother is sick, the child might get the disease. Okay. Anything else? Serial interval. What do you mean by serial interval? What else, Shrestha? What do you mean by serial interval? Serial interval mane? one person getting the disease to next person getting the disease, right? Basically, that is serial. We're not really bothered about it in chicken pox. I don't really know the exact date and exact number of days and all, but it's not that worried. I think we use, especially we use serial interval term, this thing in influenza. Okay, other disease we don't really use this term. Okay, so I'll just take 2-3 minutes more and talk about in brief about smallpox. Have you all heard about smallpox? Atul, did you mean onset of symptoms? That is called incubation period. Infection to disease incubation period. 14, 15, 16 days. 10 to 21 is the minimum maximum. If that is what you mean. Serial interval one person to another or second infection, we don't really bother about it. Okay, over here. That's mostly with influenza. Okay. Smallpox. Now, chickenpox and smallpox are somewhat similar disease, but one thing that I would like to mention over here is the rashes look similar in certain ways. Otherwise, it's not. Okay. So briefly, let's just see the difference between them. Incubation period is almost similar. Prodromal stage is almost basically similar, but the rash is different. Okay. Over here, the rash is centrifugal, palm and sole involved. Oh, sorry. This, I think, is top of the arm. Over here is in the trunk. This is chickenpox. This is called centrifugal. Okay. Centrifugal. This is smallpox, centripetal. Okay. Outside. More in the outside region. This is the one. Next thing, this photo, if you see, again, not that clear, maybe not that clear. If you zoom, you might be able to see, but this has got all stages. Here, it's all same stage. Chickenpox. Okay. Sorry, smallpox, same stage. Chickenpox, multiple stages. Minimum in the face, maximum in the face. Okay. People who've got lots of scar in their face, remnant scar in the face, that is people who had got smallpox in their life previously in their life. That is smallpox. Okay. Chickenpox does not really leave that much of a scar. See over here, sole, hand is infected. This is smallpox. Not infected, chickenpox. Okay. So this is it. If you've got, I want you all to read smallpox. Smallpox is an obsolete disease. The disease that has vanished from the world, they say. But someone with this interest in clinical, this infective disease, I would advise you to go through smallpox one, because next few years, I would not be surprised if smallpox come back again. So we stop teaching smallpox. I would advise you to go through smallpox once. Okay. Any queries? Any questions? Okay, sir. Any queries? Any questions? Okay. Now, thank you very much. Now, how was that system of asking question from that Google slide itself? Was it disturbing or was it okay? Please, I have stopped that round. Please talk over here, unmute. Those who want to leave, you can leave. Just to take your feedback. Was it a difficulty to go to that platform and type in the question?
Sir,
No, sir.
like
Yes, I did not get your question.
sir, like smallpox, it has vanished from the world. Just like
Yes.
that, if we start vaccinating people against chicken pox, is it a possibility that it will also disappear?
Maybe. Smallpox also had similar thing. People were after smallpox and not after chickenpox. Main reason is mortality. Okay, mortality is much more in smallpox, and very less in chicken pox. That's why they were not after it. To contain the disease through and through globally, if you want to vanish it, it takes a lot of money. Right now, it's still not worth spending that money. That's why they are not doing it. Anyone else? Any questions? So regarding that platform that I use right now to ask the question, to type in the question, those who typed, was that difficult? No, right? So what did you do? You swipe between the thing? If you're using laptop, you need to swipe between the tabs, right? So I think if I might be saying this, sharing this mode of presentation to others also, but it takes a lot of effort. Let's see how it happens. I'm just trying to learn new techniques that might be useful for the faculties also. Okay, so I got one question, I think. Let me just see. There was one question I just saw. What about herd immunity? What about the herd immunity that community acquired previously? Okay, see, since secondary attack rate is so high, it's again normally if you do antibody testing in the community, roughly around 90% of the people might be still having the disease, might be having the antibody. 90% or 90% might be having the disease. There are two modes, okay? One, in our part of the world, 90% because 90% of us might have got the disease in the past. Number one. Number two, in the Western world, 90% or more, even more. Why? Because they're all vaccinated now. Because of their vaccination, herd immunity is there in high level. Probably in America or Hong Kong, if you go, herd immunity might be about 99%. Either they got the disease naturally or vaccinated. Over here, it's down. But we see it in batches and it goes, it's a skip on rising and it's maintained at about 90%. Okay, anything? Smallpox. Smallpox को herd immunity, I don't really know, Prajwal. तिम्रो भन्न खोजेको के smallpox को herd immunity कति छ भने पहिला?
सर त्यो इरप्ट हुने कुरा गर्नुपर्ने जुन त्यसमा चाहिँ सर हर्ड इम्युनिटी पहिले नै भयो भने सर भइसकेको हुन्छ नि सर त्यसको कारणले गर्दा कतिको चान्स छ भन्न खोजेको खासमा
ए डिजिज फेरि हुनको लागि
सर त्यो चान्स अफ इरप्सन हुन सक्छ माइट बी भनेर हजुरले भन्नुभयो नि त्यही भएर
त्यसले गर्दा हुँदैन हर्ड इम्युनिटी भनेको मतलब त that time what they did was they were very adherent to vaccination. Okay, यसरी भ्याक्सिनेसन गरेको छ कि एउटा केस देखियो भने होल गाउँलाई गरिदिने त्यसरी एकदम धेरै नै एफर्ट लगाएर भ्याक्सिनेसन गराएछ कि दे मेड स्योर दैट ऑल द पपुलेसन आर भ्याक्सिनेटेड. दे डिड नट लिभ इभन अ सिंगल पिपल. त्यसरी भ्याक्सिनेट गरेको छ के. अनि त्यो भ्याक्सिनेसनले गर्दाखेरि नै अनि डिजिज प्याटर्न पनि सर्टेन थियो, क्यारेक्टर्सहरु थियो. आई वान्ट यु अल टु रिड दैट. बट भ्याक्सिनेसन यस्तो अग्रेसिभ थियो कि त्यसले गर्दा नै रोकेको हो कि खास चाहिँ.
थ्यांक यू सर.
हुन्छ. ओके, एनिथिङ एल्स? खाली मैले भन्नु खोजेको नेक्स्ट टाइम स्मल पक्स फेरि देखिन सक्छ किन भन्दाखेरि 1970s मा हो कि यो पपुलेसन वाज भ्याक्सिनेटेड. 1980s पछि त कसैले पनि भ्याक्सिनेट भएको छैन. लास्ट 40 years मा नोबडी इज भ्याक्सिनेटेड फर स्मल पक्स. देयर आर सर्टेन स्मल पक्स अर्गानिजम इन द ल्याब्स. युएसएसआर को त ल्याबहरुमा राखेको थियो. त्यो युएसएसआर टुक्रे यति देश भयो कि त्यो कुन ल्याबमा छ थाहा छैन हैन. So त्यो ल्याब्सबाट निस्केको अर्गानिजम चाहिँ इफ इट कम्स इन द कम्युनिटी देन चान्सेस अफ आउटब्रेक इज स्टिल देयर भन्न खोजेको. यो एपिडेमियोलोजिस्ट इन्फेक्सियस डिजिज हामी जस्तो गर्नेहरूले वी अलवेज स्केप्टिक अबाउट दिस स्मल पक्स है. जसले पनि स्मल पक्स आउन सक्छ है भनेर आउँछ है. इफ समवन सेज स्मल पक्स आउँदैन, आई थिंक दैट इज अ फेक थिङ बिकज virus is still there in the labs. Okay, and there is no specific record of where the viruses are because USSR broke down. Cold War ले गर्दाखेरि it has all vanished. वे कहाँ छ थाहा छैन हैन. त्यो त्यसले गर्दा चाहिँ फेरि आउन सक्छ. And about 40 years they are not vaccinated. Only people who are vaccinated are US Army. US Army still vaccinates for smallpox. उनीहरूले थर्ड जेनेरेसन भ्याक्सिन स्मलपक्स भ्याक्सिन अहिले पनि लगाइरहेको छ. Why are they using? Because they think that disease might come again. है त? Okay. Anything else? केही छ? छैन भने I think you all can leave. I'll also be leaving. Thank you very much.